All right, welcome. And today we are going to be interviewing a couple clinicians that work with the Eating Recovery Center, and they provide services in California, Texas, Nebraska, and Ohio. And they specialize in working with clients who struggle with eating disorders. And today we have Casey Tallent. She's a Ph.D. and she's the National Collegiate Outreach Director for Eating Recovery Center and the co-founder of the Nebraska Eating Disorders Network. After working in college mental health for several years, her work focuses on bringing eating disorder programming to college campuses. She's a national speaker at conferences and colleges. And Karen Schneller is a licensed marriage and family therapist, also a certified eating disorder specialist and a distance credentialed counselor. And she's the clinical director of the virtual outpatient services for the Eating Recovery Center. She spent the last 12 years specializing in the treatment of eating disorders. Karen is thrilled to be offering virtual services enabling college students to have access to quality treatment. And I would like to show you all their webpage for the virtual services that they provide. So you can see here that they offer the virtual intensive outpatient program. So they offer services to those with eating disorders through video conferencing. And at their webpage here, eatingrecoverycenter.com, you can get to their virtual intensive outpatient program. And there will also be a link on this blog page where you can access the information to get in contact with them. So thank you very much for both of you being here, Karen and Casey. I greatly appreciate it because we really like having experts in telemental health that are providing telemental health services, especially with specialties. So it's great to have you here, and I'd love to hear how is it that you use telemental health in working with clients who have eating disorder issues.
You want to take that, Casey, to start off?
Sure. So one of the things that we found is that those in rural areas and those on college campuses specifically oftentimes struggle to get treatment early in the disease of an eating disorder or transitional care when they're going back to rural areas and college campuses. So we developed the virtual intensive outpatient program using TeleMental Health in order to allow those individuals to get treatment earlier and shorten the duration of the eating disorder and receive transitional care to reduce recidivism rates and then returning to care. So we're really proud of this telemedicine product and are really happy to be able to get those who need care the care that they need.
That's great, and I would be willing to guess, and you could tell me, I would assume that there's research that shows the earlier the intervention is, the more successful the treatment's going to be. Is that right?
Absolutely. So the average duration of an eating disorder is about 6 years, and that can be shortened drastically if early intervention occurs. We see those who don't have early interventions and those who are older and have lower body weights entering treatment, even taking longer than that. So absolutely, early intervention is key.
Okay, yeah, and myself being a clinician, but not, I don't work with clients with eating disorders, but I'd also assume that retention plays a big part in terms of treatment outcomes, because I know that's true with substance abuse and other counseling treatment styles, that if the longer a client sticks with treatment, of course, the better outcome they get. So it sounds like the telemental health allows them to retain, to stay in treatment longer. Have you found that to be true, or is there any kind of research on that?
Yeah, I mean, I think you're absolutely right.
Absolutely.
Similar with substance abuse, the longer they're in treatment, the better the outcomes. And so we encourage our participants to stay a minimum of 8 weeks and ideally up to 12 weeks so that we can get a thorough treatment episode with them and get them the skills that they need to be successful back out in the world or back at college.
Yeah, so before the virtual services were available to your clients, when they would kind of leave the area, go back to college, then they would be, then you I guess, did you have a difficult time kind of giving them follow-up care or identifying good resources for them? Because I know especially with the eating disorder specialty, there's not always, clinicians in the area to provide services. Was
Yeah,
that a challenge?
absolutely. I mean, I think college campuses are oftentimes not in large cities where they have the resources to have intensive outpatient programs in that city. So with college students in particular, they're oftentimes going back, and it may take, the closest center maybe an hour, 2 hours away. And so it's just not practical to be a student engaged in academic pursuits and travel 2 hours back and forth between treatment. So we did find it challenging, and this has certainly helped with having reliable, steady programming for them to continue into as they enter back into their environments with the stressors that, they previously used their eating disorders to cope with. So yeah, it's been incredibly beneficial.
And can you kind of explain, like, how does it work? Like, can you kind of draw a picture for us what the treatment plan is like, so they have like an intensive 8 or 12 weeks, and then they would follow up with the virtual services, or they'd have virtual services during the intensive part and then follow up virtually, or how does that work, and how do they actually meet with their clinician virtually?
Yeah, that's a great question. So the way that the programming works, it's, Eating Recovery Center has been around for 9 years and is one of the, top disorder treatment centers nationwide that people look to for people with severe eating disorder and related illnesses. And so what we did was we took our sort of existing proven IOP programming and added the telemedicine component. So it's similar to our in-person facility-based programs in that they get about 9 hours a week of group programming, and that's a combination of skills group, process groups, nutrition groups, all the groups that they need to sort of get on track. It also includes a meal group every evening. So every evening, because it's an eating disorder treatment program, we want to eat with the patients and do sort of an experiential exposure response prevention type treatment in the moment with them. And we use another application called Recovery Record to do that, where they literally take pictures in real time of their food, and I can pull them up on my screen and see exactly what they're eating, and I can redirect them based on that. So they have 9 hours of group programming a week, and then in addition to that, they have an hour individual therapy with a therapist that's licensed in the state that they're in, and has attended TeleMental Health training specifically. They get an hour with that person for individual or family therapy, and then they get a half an hour with our dietitian every other week. So as they move through the program, our goal would be to step them down to an appropriate outpatient mental health provider, which we will work with them on to create an aftercare solution that's effective and meaningful and solid for them to return to. So we do, as I mentioned, both individual and group sessions on technology on Zoom, which is what we're using now. And the outcomes have been great. People really love the convenience. They love the access. We were worried, how older people might deal with technology and how they might interact with that. And so far, even parents of family sessions I've done, people have been amazing. I've done, I used to do family work on the phone years ago in an eating disorder treatment center, and you just miss so much. And so doing it with this technology has been eye-opening for me as a clinician, and it's been powerful for the family and our patient.
Okay, yeah. So do they ever go into the facility if they're in the virtual program, or is all of the individual and group all done through a medium like we're doing right now? So like you use Zoom, which is, like you said, what we're using now, so we can see all of our images, and so it would function like this meeting that we're having right now if it was done virtually. And so even the meal sessions, right? It would be done virtually, right?
Yep.
Which allows allows some nice privacy too if it's in their home and so forth. And so are all the sessions done virtually if they're in the virtual program, or is it some where they come into a facility and some virtually? How does that work out? How's that decision made?
It's 100% done virtually. So from the
Okay.
beginning, from our initial contact, they do an assessment with they get a free assessment with our master's level clinical assessment team. And then once they are admitted to the program, we always start with an orientation session where we review technology, how to use it, what to do if it has a problem, some benefits of telemental health, developing a safety plan so that they know and we know exactly what's going to happen if there's a problem or if we're concerned about them clinically. And then from there, they're entered into the program, and it's 100% done online. And I'll tell you, I was a bit of a skeptic at first when I was asked to be involved in this program. I wasn't sure how it would translate because I really value that in-room experience, sitting across from a patient. I've been blown away and surprised that I feel the same connection that I do when I am with a patient in person, and they report they feel similar. Like they feel like they're right in the room with me and with the other group members. And we really saw sort of a solidifying of the group in the same way we do with our facility-based programs. So it was really rewarding for me personally to experience that.
Well, that's great. I know sometimes with clients, they feel more comfortable speaking, virtually because they feel safer, emotionally safer. And sometimes they allow themselves to be more vulnerable because they feel safer, more transparent and stuff like that. Do you find that, or do you find they hide out more because of being virtual, or what's your experience with that?
My experience is they appreciate the flexibility, and they definitely don't hide out. We definitely don't let them hide out in the program. So we're, constantly interacting, challenging them, working on things. But they really like the ease of access. So, for example, we had a mom who was in the program who was able to do her individual sessions while her children were napping in her own home, and then do the group sessions in the evening when her husband could watch the children. And it was really amazing for her because she would not have been able to do an in-person program. We also had a particular student who was sort of traveling the summer between her folks' home and her school, and couldn't do an in-person program either at her school or near her parents, which was 4 hours away, because she was going to be going back and forth. And she did our virtual program this summer. And it was, as long as she had a laptop in a private, confidential space, she could join right in and get the treatment she needed.
So you don't have those lapse of time because of inconvenience, traveling not in the right location or not having transportation or whatever. And sometimes we need that lapse of time between sessions when they really need to be in regular sessions. They'll end up relapsing, right? So it kind of avoids that from happening. On the medical side, and again, I don't know much at all about treatment for eating disorders, but on the medical side, with do you take their weight at a regular basis, and how do you do that virtually? Do you actually watch them take their weight to make sure that you're giving accurate information, or how does that work?
That's a really great question. So we know that having this done virtually with eating disorder patients could be tricky because we don't have literal eyes on the patient. And so what we do is we partner with their home doctor, their school counseling center, school health center. And so they not only have to get an evaluation at the beginning of the treatment process, so before they even start our program, they have to get a full physical and medical clearance to join, where we get weights, vitals, things like that. And then every 2 weeks, they have to go back and have a contact with that medical professional who we clinicians and our dietitians will interact with to make sure that things are progressing in the way that we hope they are. And also have somebody sort of in the field, if you will, that's literally seeing this patient that we're talking with.
So you do a lot of care coordination, which is so important, and especially with their PCP, primary care physician, because even if they did go to a recovery center, to a facility, they're taken out of the home environment. And their home environment often is what causes, kind of what's the word? It's kind of a trigger, right? It triggers these symptoms. So the home environment triggers these symptoms. They're taken out of those triggers into a treatment facility where they might make improvement, but then they're put back into the same triggers And also they're taken away from their primary care physician, which they probably grew up with and have comfort with and so forth. So virtually, they're actually working on treatment while in the situation of the triggers, while continuing to have that relationship with their own PCP. So I could see how that care coordination and actually being embedded into their own environment could really be key to some great recovery.
Absolutely. That's been our experience. And for those people who their symptoms are so severe that they don't meet criteria for our program, we do have our facility-based programs that they can go to, should they need to be taken out of that environment. And then they can step down to this virtual model as they are back in the home dealing with those live triggers. And we can really help them in the moment. And yes, it's been very successful to have that experience, because they are in their home, so that it definitely brings up things that you miss kind of in facility-based programs.
Yeah, that's great. And does your program plan on expanding to more states? I mean, those are large states that you're serving. So I'm sure you already have plenty of clientele, but are there any plans in expanding any further?
Yeah, absolutely. So we will be expanding next year in the spring to many surrounding states of those that we're in. We get requests almost daily to come to a new state because of the need of services. So we're kind of in the process of evaluating which states need it the most. And as you know, the challenges with telemental health of getting individuals licensed in those states. So we're undergoing that process and determining which states need the programming the most as we roll out across the country.
Yeah, okay, excellent. Well, this has been a real pleasure. And again, for those that are watching, please visit the eatingrecoverycenter.com. And this is their virtual intensive outpatient program providing services in California, Texas, Nebraska, and Ohio. And Karen and Casey, thank you very, very much. Really appreciate your insights. And I know a lot of clinicians are going to benefit from watching this.
Thank you very much. We appreciate having us.
Sure thing.
Thanks.
Bye-bye.
Bye-bye.